So dear colleagues, now we do a continuous suture, and we use it especially in the edentulous jaw if we want to have a quick suturing of a defect. We first start with a kind of single interrupted technique. We go inside our tissues 5 millimeters away from the border, and always in a staged approach so that you have more precision. We go outside on the other side, symmetrical, again 5 millimeters away from your border. And now we do the knot we already showed you before. We go in between the long and the short end, twice around the needle holder, grab the most distal end of your short suture, and then pull it in the direction of the long end, and you see a beautiful knot. Then we go again inside the short and the long end, this time only one time around your needle holder, grab the most distal part of your short end, and then pull it in the direction of the short end. And now you see a beautiful knot. If you want to go for a continuous suture, it's now important not to do the incision of your suture. Now you continue suturing in a symmetrical way. You go inside 90 degrees angle of your needle, 5 millimeters away, on both sides of the border. And now if you put out the suture, go inside your needle and do it like this. And now you see we do a nice continuation of our suture. And now you do this kind of technique as long as your incision is. You grab the most distal part of your needle, go inside 5 millimeters away from your border on both sides, and you always have this kind of loop. Here you see this loop, and you go through this loop to have the perfect continuous suture. Now you see, and we have a perfect adaptation of our wound. And again, 5 millimeters away from the border on both sides, and we go inside the loop, coming not from this side as normal. For normal single interrupted sutures, we grab the needle inside this loop, and then we have this beautiful continued suture. And one more time. Of course, you can continue forever and ever. 90 degrees angle of your needle, 5 millimeters away from the border on both sides. And again, here we put the loop on top of our needle, grab the needle, and then we have this beautiful continuous suture. And now, how do you end this kind of suture? You again go inside the soft tissues, 5 millimeters away from both borders, and then you don't go through the loop, you just keep the loop like this. And now you do the suturing technique we also already showed, or the knotting suture we already showed. This is now the short end, this is the long end. You go in between both of them 2 times around your needle holder, then grab the short end and pull your knot in the direction of the long end. And you see again a beautiful knot. Then again inside the long and the short end, 1 time around your needle holder, and pull the suture in the direction of the short end. And then you have a beautiful knot and a perfect adaptation of your suture. So now it's your job.